Okay. Hey, Luke, welcome. I wanted you to tell us first, as we're starting our Facebook session, we are introducing our masterclass series in FICS, and our first, most important person that we have talking about their masterclass is Luke Nelson from Australia. And his masterclass is on foot and ankle pain in the runner, which is kind of one of my favorite topics too. So excited to meet with you and talk about running injuries, Luke. This is really a treat
Yeah,
for me. So
yeah,
let's tell us a little bit about yourself and how you got into particularly your interest with running.
yeah. Well, thanks for having me on, Foss. It's been great to be involved with FICS, an organisation I've been involved with for a number of years now, and I think certainly the continuing education that it provides is of the highest of qualities, and I think you're doing a great job too in your role as education chair. So when I was reached out to a little while back now to ask to contribute, I had no hesitation in helping out. So a little bit about myself. So I'm a sports chiropractor over in Australia here down in Melbourne. The lockdown capital of the world the last 2 years. I've been in practice for 18 years now. FICS is actually what got me interested in sports chiropractic. I remember attending my first FICS seminar back in what would have been 2004, and it was my first year out of uni, and absolutely loved it. I'm just like, all this stuff that I don't know, and I just have a thirst for knowledge, and that's what got me interested in my pathway. So I'm very thankful to the lecturers at the time, guys like Brian Nook and Henry Pollard and Pete Garbutt, that have given me a lot of guidance over the years. But that's what got started me on my pathway, and then went into doing further study. I did my postgrad over here through Murdoch University, postgrad in sports chiropractic, and which the FICS modules were, and the FICS ICSE was the prerequisite for. And then I went to did my masters in sports science. I went on and continued with that. Did that, and then was fortunate enough to receive my titling through Sports Chiropractic Australia a few years ago now. So I'm now a titled sports and exercise chiropractor, which is a new thing that we started over here back in 2019. That's been my journey in through sports chiro, and then been lucky enough to treat a wide variety of athletes over that time. One of my I suppose largest populations that I see though is runners, and that's something I've progressively over the years seen more and more of. I think that stemmed from enjoying treating that population and being a runner myself. I just enjoyed being around runners. It gave me an excuse to talk about running, much like we're doing right now. So any opportunity I can get to talk about running, I think my wife is thankful because she doesn't have to hear it. So that's been my journey, and then also lucky enough in that time to get over and work at the World Games with yourself back in Poland. So, and that was actually probably one of the highlights of my professional career. Actually, was going over there. It was a great event, and I know we've got the upcoming Birmingham one, which I can't get to unfortunately this year, but I'd certainly encourage any of our viewers to apply and get over there, because it is just it's an incredible experience. So that was a bit off topic, but thought I'd give that a mention, seeing it was such a highlight for me.
Well, Luke, so I follow you on Instagram, and I see your running journeys, which are really fun to see. What is your favorite event? Do you like the longest?
More the distance runners. So I myself, I'm at the moment training for a marathon. So we've got the Gold Coast Marathon over here, which is in July. So training up for that. So there'll be a few shorter races before that, but by and all, mainly the longer stuff. So I mainly see sort of mid to long distance runners, and then ultra runners as well too. But also some track runners in there in the mix there too. So the Instagram is, look, I think I actually sort of enjoy the platform. It's been actually, for me, it's been quite enjoyable to even just building that community and having like-minded professionals, and it's actually really good to see a lot of chiropractors involved on there and putting out some really good quality content, because I think the more we do that, we're helping with that knowledge translation of getting the evidence out there and to our potential patients or to other health professionals. So I think it can be a really good place for that for learning, and I learn lots as well too from the people that I follow. So it's there's always a great opportunity there.
Yeah, I agree. And, being an athlete yourself, I think it just dives more into your understanding of the athlete mentality and brain and drive, desire, because runners are a different breed. I just traveled with Team USA track and field to their national championships, which was, amazing.
Yeah.
I love working with runners as well. And I was historically a runner too. So, I think, just really understanding where a particular type of athlete comes from helps us really give that credible information, like in your master class.
Yeah.
And also it's relevant information that's pertinent to that particular sport. 'Cause I think understanding what that athlete needs to be great, perform better, can sometimes, not always, but sometimes come from being a part of that think tank yourself, like being.
Yeah. I know. I 100% agree with that. I think that people will ask, "Oh, do you need to be a runner to treat runners?" And absolutely, you don't. I see strongman athletes. I'm far from lifting the weights that those guys do. I'd crumble. But it's an understanding of what they do. If you show that interest and you've got understanding of the demands that's placed on that sport and what it takes to be that, then that equips you to be a successful chiropractor to treat that particular athlete. So it's not a prerequisite to actually do it, but just an understanding of it, as you said, is really important. And I think if you don't understand, you don't know about that sport, then ask the patient and do some research, and then again they're always they're more than happy to share what they do, and for you showing an interest in what they do, I think helps to build that connection and that rapport with that athlete.
I agree. So thinking about your lecture, which was wonderful, by the way, because I listened to all the master classes before they go up, just because I'm a nerd by nature and love to listen to the new content, but really, really great. So I recommend anybody that's listening to log on and learn from Luke and all he has from foot and ankle. So Luke, in your experience and the runners that you see, and thinking back to your lecture, what is the most common running injury that you see?
Well, by all, most injuries, the vast majority of injuries that you're going to see in runners is from the knee down. So we're going to see mainly patellofemoral pain, but then as we go down into the feet and ankle, there you've got Achilles tendinopathy is certainly right up there. Shin pain is there, and then all the things that can go wrong in the foot as well. So things like plantar heel pain, and all the differentials that can be as well. Forefoot pain. So there's a lot of vast majority of things you're going to see knee down.
Mm-hmm. And so what do you think or do you think that there's a common error in training for runners that kind of predispose them to these injuries?
In short, no. In that I think that much like every patient, that you need to take that individual just as exactly as that. And so I think that's where, and I'm a big one for examination. I think I spend quite a bit of my time in the consult, and that initial consult with an examination of the runner. So I'm spending 10 or 15 minutes just talking to them. We've pre-collected some data from them with a form, so I sort of know what we're looking at when they come in. But then we're spending that 10 minutes going through those sort of things. We're talking about their previous injuries. We're talking about running specific outside of the usual. Where does it hurt? What aggravates it? That sort of thing. But we're talking about where how much running they've done, what their goals are. So if they've got a race coming up that we need to try and stitch them up for and try and get them going, their shoe wear, we're asking about that, and we're asking about their training loads as well too. And I think that's something that is sort of often given a little bit of lip service, in that we're just like, training loads are important, but how do we actually assess that? And so that's something that I do go through quite a bit in the consult, and then outside of the consult, spending time there with that. And then after we've sort of captured all that data, then we've go through and doing our physical examination. So and running through the steps there, and then by the end of that, then we've got a really nice picture of where that particular individual is deficient or where they've gone wrong, and then formulating a plan for that individual. And that's not always. You certainly see common common trends. You see loading errors being a common one that they'll do wrong. We often see some runners deficient in strength, but it's not necessarily injury specific in that everyone with patellofemoral pain always has loading errors. Those sort of things. And I think that's for me, I find that quite exciting because it's not there's no sort of cookbook thing that you roll out. Okay, this is a patellofemoral pain, or this is an Achilles tendinopathy, we therefore do this. It's always looking at that individual, have they got sufficient strength? If they do, great. Well, we don't need to be putting a large amount of time into that. Sorry, the kids are awake now.
No, it's okay.
And so putting the time into that. So it's identifying that those individual characteristics and then targeting that for them and their injury.
I think, you hit the nail on the head where, there's getting away from the word protocol. I just had this conversation with another practitioner because that just kind of gives us the idea that there's this bag of stuff we're supposed to do with everybody, and looking at each runner and every athlete as a complete individual, because mid-distance, short distance, are you a sprinter? Are you a hurdler? You're a triple jumper? What is your goal? What is your specialty? And then that requires a different set of muscle groups and training regimes. And we need to look at every athlete as an individual, as opposed to one set standard assessment tools we need to kind of consider even when we assess, right? Because you talk a little bit about
right. Yeah, so I mean, in the course, we go through some of the common management principles. So we talk a little about, we touch on sort of some of the key mobility things that are needed, and some of the key strengths, and some of the things that we want to look into in terms of load management. So we spend a little bit of time talking about that before we really delve into all the injuries there. But it can seem. I mean, the other thing I also mentioned too, in terms of running technique as well, is something that I will assess on runners. So that's sort of all part of that snapshot. And you might not do that all in the initial consultation. It's that can be spread out over multiple visits. We've only got limited time with our patients. I think that the priority, I believe, is spent on the history. And if you've taken a good history, you can really get a pretty good idea of what's going of the diagnosis anyway from that. And then you identify from that. You think, okay, well, what are some of the key tests that I want to get out of today? So if you're thinking that they've got Achilles tendinopathy, and there might be a new runner, and they've that they don't have a training plan, those sort of things, you might sort of think, all right, well, let's spend some time today maybe looking at their calf strength, because that's one of the most important muscles for or the most important muscle for runners. And then we might look at their load management and have a discussion around that, and looking at maybe some mobility around through the foot and the ankle, and checking through there, as well as checking that the whole chain as well too, part of that holistic assessment. And I think that's where chiropractors, we're quite good at that, is not just narrowing in on where's sore, but looking at outside of that. So looking at the influence that lumbopelvic area plays on knee or hip or foot issues. So yeah.
And I think that's the fun part of assessing, is unpeeling that kinetic chain and really trying to figure out, what's the nuance with this particular patient that maybe led them to recurrent injuries, or, maybe it's something simple like toe flexor strength, or maybe something, that's a huge one for runners, right? That's kind
absolutely. Yeah. Well, I mean, that's the first thing that contacts the ground, and if if there's deficiency there, then that can load a number of structures. So yeah, and that's why I think I find it exciting, not just seeing runners, but just any patient. If you take that approach of this is an individual, and you're trying to unravel and you're almost a detective in a way to figure out why that's happened in their case. And look, we can't always say definitively, that your injury is caused from this, but we can certainly make a hypothesis and an educated guess as to why that's the case, or an evidence-based guess, and that's what evidence-based care is our experiences as well play a part of that, in terms of and incorporating the available evidence on what it might say about those contributing factors too.
Yeah, I think that's a huge statement, is that we can't always predict injury, but we can make our best guess. And also looking at the biomechanical structural that the structure that that person brings us, which might be, we're all made differently, right? So whether we have
Absolutely.
femoral introversion or retroversion, or whether we hyperpronate or supinate, there's a structural issue that we're not going to fix as chiropractors.
Yep.
And I think we need to also understand we've got to we can fix some things, but not others. How do you approach that in your,
Yeah, so I think you're right. Like there's, there are structural issues that can contribute, and I think it's something that, and this is where, like, I'm actually just doing creating a course at the moment for assessing for managing runners, but the part of that was looking into really delving into the risk factors. What the evidence said about the risk factors for injuries, and it's so muddled. You get different. There's been a number of, just in the last few years, there's been a number of systematic reviews that have looked at risk factors, and they all come up with different conclusions. Really, the only thing that consistently shows up in terms of a risk factor is previous injury history, and that's a pretty strong one to come up repeatedly throughout study after study. We can talk about that later, why that might be the case, but previous injury history. But then in terms of everything else, like things like structural issues, things like pronation or leg length inequality, hip anteversion, retroversion, tibial torsions, those sort of things, it's very mixed. And I think that the reason for that is because, again, it comes down to that individual approach, that N of one, in that if you've got, you've got knee pain, you've got Achilles tendinopathy, but your contributors are this, and this, and say you've just done too much. So your what's triggered yours has been your training loads, and for me, it's been my strength. Now, if we put that into a systematic review, that all just gets washed out. I'll say, well, there's no difference in strength. Training loads don't matter. So that's where I think it's hard to sort of take what the literature says. I think that obviously if there's something that's consistently coming up like previous injury history, then we know it is. Otherwise, you have to take the individuals in front of you, and really, you as the doctor, you as the chiropractor, need to then make an educated hypothesis in terms of, is that really playing a role? If it is, can we change it? If it's structural, you might not be able to, but can we build support around that? So, if you're suspecting that it is something to do with the excessive pronation or a rate of pronation there, okay, well, how can we build and support that foot around there? Do we need to consider shoe wear? Do we need orthotics? Do we need to work on intrinsic foot strength and calf strength there? So just, again, assessing that and what you think is going to work for that individual. And a lot of what we do is educated trial and error. We're not always certain. We can be certain of what the tissue might be involved, and even then sometimes that's debatable. But then it's just like, all right, well, this is what we're going to try first, and if that doesn't work, then we can go on to this and this and this and options. And I think that's where certainly with over the years, I guess I've become more comfortable with uncertainty now, and there's a way to, I guess, to communicate that to the runner and the patient, in that you still need to be confident in what you're doing, but you can sort of explain to them, well, this is what we're going to do, and if that doesn't work, we're going to do this, because there's a number of different ways to attack this problem and get you well, and they're fine with that. I've never had anyone that sort of that's lost it saying, no, I want to know exactly what we need to do. Yeah. So it's okay to be uncertain.
Yeah, and I think also that comes with experience, and like really getting your and being comfortable saying, you know what, there's 10 ways to skin a cat, and we're going to start with number one that works for the majority of the people, and we'll see where you lie there. And it's also getting a good idea of asymmetries that might be normal, acquired, and that asymmetries that might make that athlete great. Great example is I just worked with Team USA, and we had a girl that came in with really upset about back muscular development on one side, and she says she's been to a number of doctors that are trying to fix it and this and that, and she doesn't know what to do about it, and very upset. And I said, this is what makes you great. You've worked hard for years for this muscle. This athlete was a particular type of athlete that had that asymmetry because of the way she was doing something. I said, this is yours, own it, And so she went through a number of providers that just didn't really sit down and say, tell me what your tasks are, what's your event, what do you do, how do you execute it? And I think that's an important part, which you talk a little bit about in your lecture as well.
Yeah, that's right. And look, there, I think another great example of that is Usain Bolt. In terms of his asymmetry and the scoliosis and his left right difference that he had, and yet the greatest sprinter that ever has been. And so yes, again, it comes down to your clinical workings. Is that if you are seeing an asymmetry, is that really contributing to their injury and their performance. I mean, generally we're sort of seeing, look, anything outside of, so if you're assessing things like strength or mobility, we're looking at outside of 10%, is something to think about. If it's outside of 20%, 20% difference from left to right, that's probably something that does need to be looked into. But anything less than 10 is just, natural, can be just day to day, or can just be part of who they are. So it's something that, I assess strength, and I'd certainly encourage all our viewers and listeners to do is to be assessing strength in all our patients, but especially in our runners, because you really start to see, some really interesting findings there as well. So as well as your mobility and your motion palpation skills as well.
So look, I know you do video analysis, because you talk a little bit about that in your lecture. Tell me, what do you gain from listening to your runners run in your assessment?
Yeah, so you certainly can. I mean, you can just simply listening. So, and that's what I do is when I've got them on the treadmill. So whether we do treadmill or outside or whatever they're used to, but if we have them say we've got them in the room in the treadmill, and whilst they're sort of getting acclimatized to the treadmill, I'll just look at them, and just without videotaping, just look at them, listen as well. And as you said, things that we're looking for through there is we're looking for, you can hear for asymmetry and foot strikes. So you can hear one side that's sort of, slapping, and there's one side's really loud and the other side's pretty quiet. And you can listen for how loud that landing is. So usually those that have got a very bouncy gait, what we call that vertical oscillation, a lot of overstride and those braking forces, you'll hear them landing a lot harder. You can sometimes hear them skidding on the ground too. So if they're sort of sliding into the ground rather than sort of placing down like that, again, that's also something you can hear. So definitely using all our senses with our eyes and our ears to capture what may be going on.
And I have one more question for you, Luke. So we could talk about running for hours.
Oh, yeah, that's right. I've cleared the day, Foss, so we're good to go.
Tell me about what you feel about running shoes, and when somebody comes to you and asking for your advice on running shoes, what do you usually point them towards?
Yeah, so I think that running shoes, and again, sort of looking at the literature on that, that running shoes have not been consistently shown to contribute to injury. But it's a funny one, because people will often say, oh yeah, you're injured because you've changed your shoes, and I think that shoes definitely can form a part in our treatment. They can form a role in terms of causing injury, and so therefore they can be an important part of helping the runner. So there's a lot of things, and shoe wear, again, like with the our typical classification of putting someone either as supinator, a pronator, and neutral. It gets a little bit more nuanced than that. These days there's a lot of sort of functions in shoes. There's things like, rocker soles. There's obviously, support and cushion, the different types of foams. There's heel to toe drop, stack height, so that the height of that cushioning. So all of those sort of factors can be tweaked for a particular, particular runner. So for instance, if we know that our runners come in and they've got Achilles tendinopathy, then we might look at, so we may need to go with something with a higher heel to toe drop. So that's a higher heel versus a forefoot there, and versus if someone's coming in with a knee issue, we may sort of go for a lower drop, or getting closer to a zero drop shoe. So these sort of things, and that's where in the history I will ask them about what they have worn in the past, and also get them to bring in all their shoes. So as runners often have multiple pairs of shoes, and I've certainly got a fair stash out the back there. But I getting them to bring them in, because you can obviously then visually assess them for wear as well. So you can look on the outside, look on the upper, feel on the inside there as well, and looking for where that runner is placing that excessive load on there. So yeah, shoes are an important one, and yeah, once with a lot of runners, once you start talking shoes, a lot of their eyes light up. So it's
How many pair of running shoes do you think you have in your closet?
I've currently got in rotation. I've got six. I've got 6 pairs. She got 6 pairs in my rotation at the moment. Actually, I just added a 7th the other day. So that's in active going. And then the rule that we've got in our household now, that's my wife enforced, is 1 shoe comes in, 1 shoe goes out. So I've sort of stopped it. I've got a few extra ones in there though. You've snuck in. I've got probably. I think I'll probably have kept on to a few older pairs, because I've got some, especially some shoes, like, you know, some of the minimalist shoes I've done, you know, thousands of kilometers in those, and they're still good. I don't wear them much these days, but they're still there. So I've probably got maybe, you know, 12, 13 pairs at the moment. But yeah, only 7 of which I'll sort of rotate for different runs, or depending on how I'm feeling. Like, if, you know, the calves are particularly sore. Sorry, that's the dog there wanting a breakfast.
A whole lot of today.
Yeah. So if I've got particularly sore on the calves one day, then I may put on one of these shoes that have got a little bit more of that heel, or I may opt for one of the carbon plated shoes that are around these days. So, you know, what we call the super shoes. So your things like your Nike Vapor Flies or your Alpha Flies, and so there's plenty of those on the market these days as well now. So, and they're if you're looking for a way to spend some money, they're a good way to drop some cash on the super shoes. So have you got a pair yourself, or have you ventured into that?
I think I beat you. There's an emotional attachment to shoes, right? Especially for you, they did long runs in those shoes. I have about 20 something pair, which my husband asks me to throw away all the time, but I don't.
Yes.
But I did make some room on the shelf for his shoes, because there was no room for any of his shoes.
Well, it's good you made some room. That's good. But no, that's impressive. But as you said, you know, runners often have a lot of pairs, and you know, those older pairs can tell you a lot, because, you know, sometimes you'll have a runner come in with a new pair of shoes, and it's like, oh, I actually want to kind of see your well worn ones, because that sort of gives me an idea of how you've worn into that shoe. And again, like, it doesn't tell you anything by itself, but, you know, putting that together with looking at their running gait and looking at their mobility and that sort of thing, there can you know, formulate that picture and put things all together.
Yeah. Well, Luke, really great information. And anybody that's listening, please get onto the masterclass, get onto fics.sport website. Luke's lecture is just really amazing. I listened to it more than one time, I'm going to admit. It was really great material. I recommend it highly. Thanks, Luke, for coming on today and spending some time with us. Tell us a little bit about running.
Thanks, Foss. It's very kind.